Let's talk about the severe combined immunodeficiency as a genetic distinct syndrome. Okay, so this severe combined immunodeficiency is also called the bubble boy disease. All right, do you know why it is called the bubble boy disease? It is called the bubble boy disease because you have a severe combined immunodeficiency. Like you have a totally weak immune system. Your T lymphocyte are not functioning, your B lymphocyte are not functioning. So you need to be kept in isolation in an enclosed place. So it's like a boy inside a bubble being protected from the whole world. Do you understand? That's why they call it a bubble boy disease. All right. That's a severe combined immunodeficiency, also known as what, a bubble boy disease. All right, so you can see a normal person, their immune system have T cells and B lymphocyte, and the immune system help them to actually fight infections. But if you have a severe combined immunodeficiency, your T cells and B cells are like cancelled out, so you can't fight infections, right? So you need to be kept in an enclosed place, being protected from anybody or the world, the whole world at large. Okay, so you are a bubble boy. You are a boy being kept in a bubble. Okay, so now instead of severe, we'll be looking at from the definition, causes, symptoms, diagnosis, treatment, and complication. If left untreated, it's basically lead to some other crazy stuff, right? So let's talk about from the definition now. Severe combined immunodeficiency, also known as the SCID, is a rare genetic disorder that affects the immune system, making it difficult for the body to actually fight off infections. All right. So here are some key points you should know about this severe combined immunodeficiency disease. Okay. Causes, it could be genetic mutations inherited from parents. Okay, so before you marry, it's good to actually always do some testing to see if there's any possibility of transferring any genetic diseases to your offspring. Okay. um Defects in genes involved in immune system development. Okay, so there are some genes that basically encode for your immune system properties. So if there's a defect in these genes, then there will be a problem. The symptoms include what? Recurring infections like ear infections, sinus infections, respiratory infections, and skin infections. And when you have these infections, they are hard to treat, or they keep coming back because you have a weak immune system. It's not all about treating a disease condition, all right? And treatment for disease condition also has a link to how strong the person's immune system is. Okay, then the person will have a slow growth and development. All right, be having diarrhea, that's running stomach, you'll be having mucus discharge, you'll be having skin rashes. Okay, you can see this child actually has a bubble boy disease. I don't think all this stuff is it actually like to make him be inhaling clean air or something, all right? But you can see obviously he's being protected from the whole world, all right? The kind of clothes he's wearing is special, all right? That's what we call it, the bubble boy disease. So diagnosis now, yeah, you like to actually do a blood check to check if there's any immune cell counts and function, if there's any abnormality. They do a genetic testing to actually identify the mutation, all right? Because it's not good to actually just be treating a disease condition without knowing the cause root. They do a bone marrow transplant, that's to replace the stem cells that make all these white blood cells, red blood cells, platelets, and the rest. Okay, they do gene therapy too. All right. Then immunoglobulin replacement therapy. You can also do it. They do some antibiotics and antifungals to actually manage infections from bacteria or fungals, or you could use antivirals for bacteria. Antivirals for what? Infections from viruses. So these are the common symptoms: oral infection, common symptoms: oral fungal infection, lung infections, gastrointestinal infection, failure to gain weight, and other bacterial infections. Alright, so what are the complications now? Uh, Definitely, this can weaken your immune system and predispose you to a lot of crazy other infections, right? They could have some organ damage too. Your liver or lungs can be damaged. This can lead to cancer. This can lead to death if left untreated. All right. So this disease now, which is termed the word severe combined immunodeficiency, it refers to as a bubble boy disease because affected individuals must be protected from infections, and they are often in isolation. All right, until treatment is successful. Early diagnosis and treatment can improve survival and what quality of life. Okay, so guys, that's it about the severe combined immunodeficiency, also known as the what bubble boys disease. See you guys pretty soon.